Hello, Mr. Daly. How are you? You're muted.
Yes, I am still muted. That's Andre. That's Andre. Andre keep muting all of us. He says
Blame yourself, boss. Blame yourself. You're the wrong thing.
right. So I just thought Andre had set up everything. Those of you who are following me live, here's literally my Dunkin' Donuts. Here it is right
So
here.
where's my coffee? That's what I want.
You need to, why didn't you come into the studio and get me a copy?
No.
I learned that Haitian women, they take care of their brothers and their fathers. They
Yes.
do that.
And you need to stop right there. And Haitian men take care of their women as well. So don't go there.
Well, it starts with the woman, right?
I don't think this is a topic you want to touch because you're gonna lose.
Am I gonna lose this one too?
Yes, absolutely.
Kumbaya, man.
Give it
Ladies and
up
gentlemen, I
right
want to thank you for joining us right here in the village, where we're dedicated to empowering the community to live a healthy, safe, and financially capable life through education. Letting you know, helping each one of us in realizing our dreams at any point, at any time, starting from today. What are you doing to be successful? Right? Success is not just spoken, it is done. So tell us what you're doing. Joanne,
Day. What are you doing to be successful?
it's reciprocity. What you're saying is reciprocity, right? Is that what I hear you saying? That is
now.
reciprocity?
Yes, absolutely.
All right. So I don't want a Haitian woman. Then I'm gonna stick to my Jamaican way. It's not about reciprocity. All
Well, it's okay. We don't want you either. That's okay.
That's not true.
You stick with who you have. Okay. You don't need to search. You got the best one. So stay right there.
You're right. As a matter of fact, she and I was telling her yesterday how hot she was. She looked at me like out of the blue. I just said, you know what? After 30 years, you still look so hot. I used a word in between that I can't put on the radio. Right?
Yes, but God made her just for you.
Right. And so
only she can deal with you.
Wait, hold on. Yeah, Garcia. You know what the first word out of her mouth was? No. You know what the first word were?
Thank you.
No. I wish it was thank you. It was like, what are you begging? Hey John, what's going on? How you doing? What John, what are you doing to be Dr. Brian says she's sticking with Haitian men to be successful. What are you doing to be successful? I'm sticking with my wife.
Wait. I never said that. Don't
I got her good. So wait, John, what are you doing to be successful? What were some of the things you worked on this week to be successful? What's your last week and this week?
Focused.
Listen to the political answer, Joanne. So you're gonna answer the same way, the same political answer. Go ahead.
Faith and family.
That's it. See, he's so full of malaka. Say he was gonna answer. So what are you doing? What did you do, Joanne, to be successful?
And El Dorado 15.
Oh yes, I know what that is. The guy needs rum, huh? So what are you doing to be successful?
Just taking.
What did you do? What did you put in place? I know you start back school today too, right?
No, I started last week. Correct.
Oh yeah, that's right. I keep forgetting you're not in school. You're on the administrative line doing that work. So tell me, what you last week in this week? What did you do?
Prepare for our new testing mandates that's going to be coming in place. So just trying to make sure that we're getting everything in gear. You know what? What you're about to do is what I'm about to do. Turn my AC on. Correct. My AC on. I need to do that too.
How you know it's AC? You heard me say AC?
No, I saw you maneuver towards AC. So do I know you or do I know you for now? But yeah, just trying to make sure that everybody is excited and ready to go. I'm excited about the school year. This is year number 2 in the pandemic, and we have succeeded so far. So thank God we put a lot of structures in place, a lot of positive things, a lot of cautionary measures in place. And we want this year to be successful. Yes, people are coming in with fears and all types of everything, but with fear, we can conquer all. With God, we conquer all.
You said with fear, we can conquer.
No. Fear, we have to trust God and we'll conquer all. Thank you for corrections.
Okay.
No, thank you.
I got.
I had to make sure of that, Doc. I like the way that sounds.
Right. Before I have bittersweet news as well. I forgot. I hate doing that. First of all, let me tell you the bitter news.
But
first.
you always hate to do it, but you do it.
Yeah.
So.
Well, sometimes
so stop giving us the disclaimer and just do it.
No, but you know what happened? I like the audience. I like you guys.
We don't want no disclaimer.
I like you guys. You guys are.
Give it to us straight.
First of all, so on Monday, one of my colleagues and friend, subordinate and friend, passed away. Irma Hilaire. She used to be a school aide over there at one of the schools that I worked in for a number of years, and it was just sad. And you know what, this cancer thing, John and Joanne, J and J, it's really, it's just terrible. Like, I mean, my mother-in-law, who we buried last week, found out in March, died in April. I mean, died in August. My colleague friend, she found out in April, and she's gone on Monday. So that's and it's funny that they're finding cure for a lot of these things, right? They're finding cure for a lot of these things, and when you look at it, so if you're finding cures all around the world for these things, what's going on with something that's been around for an eternity? So my heart goes out to the Hilaire family. Her children. A few years ago, she lost her husband, so now all of her children are now without parents. So I'm just paying homage to her and her family. The good note was that my father celebrated his birthday on Monday as well.
Wow, they're a week apart, your mom and your dad.
Well, actually 4 days apart. One is the second, one is the 6th. Yeah. So they both celebrated their birthday on this month.
God bless them, man. Congratulations
on
reaching their milestone in their born dates.
Yes. So congratulations to both of my parents. And it's funny that we talk about that because our guest, Randy Bowen, who'll be coming on in a few minutes, he's going to talk about counseling and dealing with crisis and traumatic
trauma, my brother, trauma.
Yes.
You know what? I want to add to what you said. This cancer thing is definitely. I was speaking to a friend of mine this week that it is every time you turn around, you're hearing something in regards to cancer, and it is traumatic, completely traumatic. I would say 2 weeks ago, my stepson, he lost his mom, and the day before his 30th birthday. So it is very traumatic to think about. Hey, you know what? I'm about to celebrate life, and here we go. You lose a major part of you. So, but there's nothing that's impossible, because guess what, Roger, you've been fighting, and you have been winning, and you will continue to win. You and many others. So
it's a good fight, right? It's a good fight, and you know what I liked about Irma, like she called me up and she's like, "What do I need to do? What do I need to do?" And she was willing to fight.
No, you know what? Definitely, and she was, as we would say, she put up a good fight. But when the man upstairs calls you, he calls you.
That's true.
And it's all about just dealing with trauma. So Randy, you know what? Why don't you come on in and help us understand the whole impact of trauma and ways in which we can deal with it.
All right. Oh, so you Randy, you ready for us? I mean, the boss just called you in on air right away, right?
Yeah, I'm like sitting here backstage. I'm like, am I on?
I saw your mouth moving, but you weren't on stage yet.
Well, that's all the laughter from your banter, and also the sadness of kind of the reality of life. Like you guys are talking about. Well, good evening, everyone. But you guys are talking about the process of life. So I lost my grandmother and 2 aunts like within the span of 4 or 5 months. My grandmother, COVID complications. My aunt, COVID complications. Aunt, cancer. And then I had my first kid in July. Right. So it's definitely
what did you say happened last week? I didn't hear you.
So I had my daughter in July. So I lost these 3 family, and these are like, this is grandma, like big mom, right? Like matriarch, the person that everybody went to for healing and support, and
right.
And I have my daughter in July, and it like Dr. Bryant, you said it's bittersweet because you have this person that means so much to you that you was your beacon and just generally and always just excited about your life,
Right.
and you're bringing in this life, and now those lives don't necessarily connect.
Right.
But I'm reminded that when I look at her, there are certain mannerisms and things about her that I remember about my grandma, like the way she moves, and it's little subtle things. And so I like to think that, she's still here, through her.
And Randy, you're right. What this reminds me of the Lion King, about the circle of life. And when someone dies, someone is born, and traits that you think that are lost, those traits are materialize and manifest into someone who into someone who was born. So this is, and the way I deal with it is the realism of life and what it is. That death and taxes are the only two certainties in life, and they always talk about you have your born date and then you have the date which you pass. But the most important date is that dash that sits in between what you have accomplished during that period of time. So what I think what it really boils down to is that we tend to take life for granted, and life can be one day, 1 second, one moment. It could be a decade, 2 decades, 3 decades. But I think what the point is that while we do have that time, what we need to do is better understand our relationship with God, and second of all, understand that we need to just live life, live life the way God intended us to live life, without fear, without regret, and just enjoy the ride. We're on the ride, so just try to enjoy the ride. And during the period of time, we're definitely going to face a lot of tragic trauma. Just take for instance Saturday, September 11th. I'm quite sure a lot of us have lost a lot of friends,
Right.
or have known people that have passed.
Or some people are still suffering.
Or some people are suffering from the effects of September 11th. So, I think it's right on time for you to be here, especially it coincides with Saturday, what's going on, because there's a lot of mixed emotions that people are feeling right now, especially the villagers. So, thank you for coming on.
No, I got excited. I sent the article to Mr. Daly because I actually, he's one of my models in high school, and I don't even know.
Hold on. You said what?
Mr. Daly, yeah, I call him.
What?
I can't. You guys know him as Roderick, or he's also known as Rudy. But to me, he's always Mr. Daly.
Man, come on, man.
Randy.
Don't start.
He says my name the same way he used to say it.
Let me tell you something. When I was in, I don't know if you remember this, but I used to call you by your last name. I used to call all my students by their last names. But I try to explain. And now that you are in, wait, you know what? Let me not steal that thunder from you. Tell us a little bit about yourself, who you are, what do you do, and why you do it. Just tell us a little bit about that.
Sure. So I've been and I was having this conversation, the school counselor versus guidance counselor. So guidance counselor is the term that everyone knows, because if you're an older person that's been in school, you have a guidance counselor. The field has changed where they don't want to, I think we want to remove ourselves from what historically a guidance counselor was. And a lot of people feel as though guidance counselors were more reactive than proactive. So you would have to go seek your guidance counselor and you would have to go ask them questions. And I think the field said, you know what, let's drop the guidance and talk and add school. And the school component is thinking about 3 aspects of every single student that walks into your building. You're thinking about their social emotional, obviously, primarily. You're also thinking about their academics, and you're thinking about their college and career. So you're assessing the school, you're looking at data, and you're thinking about ways you can incorporate those fields through programming or outside organizations or conversations and so on and so forth. So I've been a guidance counselor. This is going to be my 14th year at Community Health Academy of the Heights in Washington Heights. And I also realized during my time of working at SHA that a lot of my students, as most students do, as we all did, deal with some kind of trauma.
I'm interrupting you because I please don't mention that year, because that would make me so much, because that means you went to college, you went to get your master's. That makes me real old. I don't like that. All right.
It's not about how old you are. It's about how you feel.
Yeah, we can't hear you, Joe.
Repeat the year.
So I've been a guidance counselor or a school counselor for 14.
You really did repeat it?
Yes. Thank you.
I'm gonna say when I graduated high school so that everybody can know.
Let's go.
I took Mr. Daly's Spanish class in 1997.
Wow. Wow.
So you do the math.
24
you know what?
years ago.
24 years ago.
You need to stop.
24.
You need to stop.
24. That makes you about 60. Old ass.
Well, if you carry the 1, maybe. But you're being very generous with that number.
Wow. Wow. You know, actually, that was my 2nd year at South Shore.
Here you go.
So 97. Yeah, I started South Shore in 96.
So, I mean, you know.
Really, Samantha? Really? I'm 71.
71. I told you, I think they didn't carry the 1.
If I'm 71, Samantha, that would make you about 81. How was that? How was that?
It's all good. Black don't crack.
Yeah. Thank you. Yeah. You try to recover.
In Roger's case, it's shattered.
So you were telling us about, this, although I heard the term, this term came up about 2018, 2019, when they started using the term school counselor, not guidance counselor. And somehow I feel that the word guidance provides an important role in what you do, right? Yes. But I'm gonna have to go ahead and respect the new name, right? I'm not gonna say, we still do it because we're used to it as old fogies been in school saying hi, right. The guidance counselor, and we tell them, just like kids say gym teacher, and we tell them it's not a gym teacher, it's a phys ed teacher, because the gym is actually a room, not actually the class. The class is actually physical education.
Right.
But the idea of guidance, and you touched on what some of the things that you do in terms of college readiness, steering a career path, the social emotional needs of the child, balancing that with the academics, right? Because a child can't learn if they can't think about learning, right? They nobody can learn, right? If you're stressed about eating the 7 necessities of life, right? Your food, your shelter, your clothing. Well, we're going to leave one out because you need to figure that out when you're older and married. But the others, the other 6, you're good enough to go, right?
I can't with you.
Really, John? You had to say it?
Really?
I like how you said when you're old.
He's older than me. So if I'm 71, he's older by a couple of years.
Hey. Audience.
Which one look older, right? Which look older? All right, you know what?
I at that point in time, I dropped the mic.
Yeah, Randy. So go ahead.
Yeah, I'm not gonna comment on that. I don't want to break up Kobe and Shaq, but but it's interesting you say that. So I don't know. I think the premise was, again, the working in isolation, right? Like, you're a guidance person and people go to you for guidance, but how are you immersing yourself in the culture of the school? And I think that's where the school came from, is you're not just there to kind of touch one life, you're there to touch many.
Right. But the thing that I'm saying is that you could make that argument for every single profession that's involved in education, right?
Yeah.
As a teacher, technically as a teacher, you don't teach, right? You facilitate the learning that's involved in the classroom. So change from teacher to facilitator. Culinary engineer. Everybody. You can add a title or a switching of, beings. But again, school counselor it is. School counselor it is. So 14 years as a school counselor. And tell us about what made you, because what you taught, because I think most guidance counselors have to teach first, right? Did you teach first, or you were
No, not at all. So I actually went to college for finance. So I attended Baruch College, and at the time, it was all about the stock market, right? So I told you guys, 97, that Spanish class with daily. 2001 is when I graduated, right. And with the intent of being this Wall Street bigwig. And then September 11 happens, market crashes, and they're like, well, what are you going to do, right? And I still, you persevere, you proceed, you say, what, this is the plan. And as a young Black man, you're like, all right, the college has to work. And going a step further, you're thinking about like, all right, I need to do the right things. What are the right things? Not get anybody pregnant, stay out of jail, graduate. And then like the American dream, I have a life. And that's not how it panned out. And I think that taught me, and like those lessons are what I utilize when I approach the career aspect of my job. Is you can have an interest, but what is the network around that interest? How is that interest being explored? Who can you talk to that can potentially support you with that interest? And how do you really plan that out? So fast forward, I worked at a company doing licensing, and I hated it. So I went to St. Joseph's College to speak to an admissions person who at the time was at LIU Brooklyn doing the same school counseling program. And it's funny you asked that question about teaching, Mr. Daly, because when I decided to go into the school counseling,
Randy, hold on.
Yeah. What do you want me to call him? What do you want me to call him?
Rudy or something, man.
All right, Rudy. So you're gonna give it to me the whole night. All right, fine, Rudy.
I personally am gonna give it to you.
So I went to the person, spoke to her, whatever the case may be, and ironically enough, I found out that the DOE gave out scholarships for like bilingual school counseling. So I was like, all right, I'm gonna see if there's any kind of school counseling scholarships for me. And I went to speak to someone at the DOE. And they saw the degree finance, and they were like, oh, you'll never find a job as a school counselor. Why don't you just be a math teacher? Because it's finance. So I was like, obviously, you must know math.
They correlate. Gotcha.
All right. And I was like, well, I don't think that that's necessarily, the thing that I wanted to do. But at the same time, you're kind of still like, I'm not sure. I'm like a career changer, so on and so forth. Take a class. And I think it was like a practicum class where it's like they give you scenarios and what do you say to these things? And it was an example of like a kid trying to communicate with a practitioner, and she's like, "Well, how would you internalize and process and then answer this kid?" And no one can answer this question. And I'm in a program, being one of only like 3 males, and I thought about it a little bit, and then I said it, and she's like, "Wow, like that is exactly what you should be saying. And that's exactly what you got it." And that's when I was like, "All right, light switch, light bulb. I'm on the right track to finding my passion and my gift." And then I, was able to get into a school, and I did some kind of internship and volunteering before that, just to kind of, again, feel out and figure out if this is the path for me. And then got a job, and 14 years later, been doing it ever since.
You're very lucky because guidance and school counseling is hard to get into. A lot of people graduate and they are not able to get a position. So you were very fortunate.
I was, but the thing is, I think pragmatically about things as well, right? So one of the things I realized is like, okay, like it's a female dominant profession. And someone told me this. They were like, you're gonna find a job because you fit the bill, you're Black, you're a male, And those back then I would like, that was the population that was really struggling.
Well,
So if you,
still the same with education still, not having enough male educators is still an area that we have a shortage.
Right. And when you have someone like a Rudy, where you like that's the connection where you're like, wow. And that was I think the connection for me to Rudy
was motivated you.
Was that
he motivated you to get into? No. That's important. That's important.
Yeah.
Well, I don't know.
Wait, Mr. Bowen, I'm gonna step back, right? Because it's like Rudy Toasting Day, so I'm gonna step back. Etienne Cole wrote that I wanted to do school counseling also, but mental health counseling was more dynamic. So that's interesting. And he's another, of course, I'm not sure what his picture saying.
Yeah.
Maybe that's what makes it dynamic.
That's
mental health. You can go off.
I got you.
Did he? It's funny you said. Did he motivate you? I wouldn't say necessarily. Right. Yeah. He like not necessarily like, oh, he's the person that made me think about education. Because at the time, and I think for most high school students, especially ninth graders, right? Like, how do you know what you want to do? No ninth grader knows precisely what they want to do. And I was like, the only kids that I find have a solid idea is they have somebody in their family that does it, and they're kind of being coached up to do that thing, right? So it becomes part of a family job or profession, right? And even then, it doesn't stick.
And to change, because more and more I find that children who parents are educators, they want nothing to do with it, because they see how many hours you dedicate and you put in and you spend coming home, and you don't have enough time dedicated for them because you're so busy putting all that energy into others.
Right.
So that's where they suffer. So I wouldn't say quite, hey, if my child is watching me as an educator, they're like, totally no.
Well, I don't necessarily think education. I think like I'm thinking like medicine or law or like engineering, not necessarily education, but just these different fields and professions that their parents are their exposure to it. And I feel like for me personally, my exposure for the most part were people who did like city jobs. Like I was one of the first to attend and graduate college in my family. And to your point, those jobs I saw and I was like, I definitely don't necessarily want to do that. But I think
you don't want to do what?
Okay, so like my mom was in housekeeping in a hospital, and my dad was a conductor for transit. And they're honorable jobs. Don't get me wrong. Anybody that does like I respect what they did, and because what they did paved the way for what I'm doing now.
Exactly. That's the
right.
I think that's the point that needs to be taken from. I mean, you don't want to go that step, but it was based upon their foundation that gave you the opportunity to do what you're doing.
Absolutely, and I didn't want to go that route, not because of shame, but because I understood that they sacrificed so that I didn't have to do what they did. Right. But the motivating factor, back to Rudy, is seeing, a man of color in a classroom and able to connect.
And come on, man.
I'll give it to him. I'll give it to him.
The only thing is, John to my left is very, very jealous man. So he's like Carmelo Anthony, where he just wanted all the spotlight. So poor Jermelin had no chance in New York to help the team. That's him right here,
hanging on to his NCAA laurels.
Exactly. That's John right here.
But
we'll ignore him.
I want to find out more about your therapy. What actually do you do therapy? Tell me more about that. Let's find out more about that.
Well, counseling in itself, even your conversation with a confidant about decisions is therapy. And I think we need to also think past the idea of therapy being you speak to someone that you sit in the chair, you lie down, you talk, 45 minutes later, you're healed and you walk away. Therapy presents itself in a multitude of ways. As far as like the therapy, the EMDR, and what I've practiced is what I've realized being in.
By the way, just for clarification, right? One, you went over that too fast.
Sorry.
And then because I love that. I always talk to people about that. Like when somebody leaves a voicemail and they go, "Hi, this is Randy Bowen, and my number is 7. And I'm sitting there going, "Okay, I know you know your number, and I know you know your name, but I don't. So you need to say it a little slower."
Okay.
Right?
Well, I was gonna get back to it
and tell us what it means first of all.
All right. So let me get to the backstory of it. So 14 years doing the same, but let's say year 11, right? So working with students, again with the 3 tenets: college, career, academic.
Right. Go back. Your school is a high school, middle school, elementary school.
So my school is a 6 through 12 school, and the population that I worked with was that
co-ed, single
co-ed 6 through 12, small school, founded in 2006, and I started 2008. Like predominantly Hispanic in the Washington Heights community. And they, I love my school because they represent kind of where I came from. First generation students just trying to, make a way for themselves. And in working there for a long time, obviously in any organization, you start to see some of the deficiencies or struggles, right? And what I realized is a number of our students struggled with trauma, and not necessarily brief trauma, like deep-seated trauma.
Right.
And most counselors subscribe when you're in that profession and you're in your grad program, your professor asks you to subscribe to a theorist, right? So, Freud or Erickson or whoever you subscribe to, and your practice comes from that place, right? So your application. What I realize is with the counseling programs, they focused a lot on the psychotherapy or the therapeutic process. But when you left, you left. And so it was up to you to continue your education to figure out strategies to support students. And in the process of me working and finding and figuring out that the students that struggle, what the student that you see now that's struggling isn't struggling from something that happened yesterday. It could have been something that happened when they were 4 years old, 5 years old, 6 years old. And I started seeing a common theme with many of our students where, like, for example, single parent household, the mother was abusive, but at the same time, it's the mother. So the child's confused because they're like, well, this is the dynamics of how our relationship always has been. And in their minds, they're like, this is how the relationship should be. But they're angry. They don't necessarily know how to vocalize that anger. And then you have a myriad of different feelings in between those two parties. Yet they have the same goal, but they don't understand what's blocking the relationship from working a little bit better. And so in me talking to various kids, and I say this, and for anybody that's in education, and you can disagree, but I feel like my kids are, the personalities are the same. The kids are different. So there's that one kid that fits this personality type, and that kid is going to be present every single year. They just have a different name.
Right.
And they all struggling with this very similar things, right? Because the neighborhood is the neighborhood. So a couple years ago, I realized that talk therapy does work, but it doesn't get necessarily to the deep-seated issue because it's hard to pull it out just by talking. So I was introduced, actually got married, and we had like a marriage therapist. And one of the things that she showed us was EMDR. And EMDR is a kind of psychotherapy. It stands for eye movement desensitization and reprocessing. So in just regular talk therapy, it's hard to, and just the brain, it's hard to remember every single moment of your life, especially when it comes to traumatic situations, because the brain is actually designed to forget traumatic situations and to put it far, far, far into the closet, I like to say. But the thing is, you go to your closet once in a while, you're like, oh man, I didn't know I had this dress, or damn, like these sneakers are here, right? So you come out, you may go into the closet with a different intention and come out with something else. Right. And that's what happens. And you're not able to articulate and connect the two different what is happening now with what has happened before. So what EMDR does is essentially, and if you Google or you YouTube EMDR, you're gonna first response gonna be like, this is some weird stuff. People think it's like, when they have the clock in front of you and they go into this deep sleep, and then when you're in that trance, you talk about things. People think that it's immediately like that. But the eye movement is to activate the brain, that part of the brain that's connected to that past memory and trauma, and to get the person to reprocess that trauma and bring it out while at the same time being in a control state. Because the thing is, if you bring that trauma out and you don't have trust and it's not in a control situation, it can be very, very bad. So there's, with everything, there's always controversy with every single thing, right? So with EMDR, depending on who you talk to, they'll say, okay, it's a great thing, it's a great tool. And another person will say, well, it's very dangerous if you're not trained in it properly. So in my training, and just working with it, I realized that some students, not all, have these deep-seated difficulties, but they aren't able to come to terms with it and cope with it, or even articulate it sometimes. So the EMDR allows that, and again, in a control setting, and there are like safe words or different things that you can use to pull someone out, because when you get into it, they can really, really go deep into their memories and their histories. And again, it can be very, very painful depending on what it is that you're.
Are you doing this in school?
Mm-hmm. So here's the thing though. So I got trained for it in 2021. I trained for it in 2019, and I'm like, all right, great. I'm ready to use this, because I was working with this particular student who's, her mom and her issues, and there was like physical abuse, and again, that dynamic was like difficult, and now the mother's like, oh, I'm behind you 100%, but I'm not really, and it was just a lot. So I was like, she would benefit so much from it, because she also suffers from anxiety, but she can't tell you why she has the anxiety. And I've seen from the work with the personal therapist that EMDR really, really supports people, and in this case, students with anxiety. So I got trained, ready to go. I'm like, yes, I'm going to do this. I'm going to support this person. And then COVID.
Is EMDR similar to hypnosis? It sounds like that's what it is.
That's the parallel that most people make, because you're essentially trying to get the person out of the present, get them to the past, but at the same time focus on them being grounded, so that you don't lose them, so to speak.
So go ahead, Joe.
I would say that's kind of scary, to be that vulnerable in a space to say, hey, you know what, I'm gonna try that. So I would be reluctant to try it. It might be great for me, but I don't know.
I'm thinking something about what Joe just said.
Watch it. That's
I'm
all.
waiting. I'm waiting for it.
But it's not gonna come. Okay. I'm gonna let it go. I'm gonna let it go. But I have this expression that I give to my wife: grok, gradual release of control. Gradual.
So you're trying to say I'm a control freak? Is that what you're trying to say?
That's exactly what you just demonstrated.
She's not a control freak. She's not a control freak.
Wait. Randy?
No.
Rewind the tape. I'm gonna see your head shaking. Yeah.
She's not a control freak, because
I see you trying to cover it, but
no, I'm not trying to cover it.
I got you on that. Don't worry, Mr. Bowen. I got you. No, you're not.
She's not a control. Like, here's the thing.
A scaredy cat. That's
with EMDR, you don't just walk in saying,
Dr. Brian, I wouldn't do it either. Don't worry about it.
Listen, with EMDR, you don't walk in saying, no practitioner will say, first of all, in order to assess a person's situation, you need to actually assess. You can't just walk into the room and go, you have this issue. Or if the client or student says, I have this issue, it's never that easy. Because remember, this stuff is like deep-seated. So it's a tool. It's not like the system. It's just a tool. It's a part of talk therapy. So the hope is that you've developed a relationship with the practitioner. There's a level of trust, right? There's a level of consistency, and that's the other thing that I found with my students is that a lot of the ones that suffer, there's a lack or break in some kind of consistency in their life. And a lot of times they're stuck in that time period where that break is, right? So it requires a lot of back work where it's not hypnosis. And that's the problem with when people think about it. It's just like, oh, you go to your practitioner, you sit down, he has that that yo-yo or clock or whatever, and you're sitting there, you're dazed out, and then they go,
that thing where you have
you call it
keep your eye on it. No, the thing that spins like black and white and it keeps spinning like it just keeps going. And
you mean the Ferris wheel?
Is that what it's called? No, not a Ferris wheel. No, it's black and white. It's black and white, and it keeps spinning like a gig, and it just keep going like this. Keep your eye on this.
Spiral.
Like it's a spiral.
Yeah, I don't know what it's called, but I know what you're talking about. Yeah.
I mean, I'm not totally crazy. I'm somewhat crazy.
Somewhat.
So while you at it, so what you're talking about with the school, that it's not like Dr. Bryant alluded to, like she would be concerned as a parent to allow that to happen to my child. So this is something that you do. Is this something, have you tried it in your school? What does the administration say? Or is this something that you totally do in your private practice? Because I know that you're a private practice.
I couldn't try it in school. COVID happened, and then that was it. So all I've been able to do is kind of read up and do research on extending the therapeutic skill. So I haven't even been able to try it. I'm excited now that we're back because there is going to be a lot, and not necessarily maybe trauma, because this is, if you're talking COVID, this is over 2 years. So you might not necessarily need that kind of therapy. But I'm excited to be back for the students, like I said, that, they've been with us. We're 6 through 12 school. So they've been with us for a long time. And this COVID thing may have compounded that past thing.
Right.
And again, it's not something where I'm like, I'm running around dying to use this new thing. It's just a matter of being equipped to support it. Because I felt that, you talk and talk and talk, but you don't necessarily get to the root of it. And the thing is, like, our school, we have social workers. We're attached to a clinic that has social workers, like very, very comprehensive services. But I'm worried about them when they graduate. Like, what happens there? Because if they don't have a therapist or a practitioner that they're working with in high school that can, if necessary, bridge the gap towards another practitioner as they get older and become an adult, then they don't get any kind of support. And then what you find is, because our first graduating class is 2012. So I have students that graduated who are teachers and physical therapists and stuff like that. And you find that some students are still dealing with the same thing that they were dealing with in high school, which means that they didn't get the support necessary to mediate that.
So I want to continue the conversation. Well, I have a quick question, the side question outside of your realm. And I'm always confused, right? So
that's true.
When you have a school-based support team,
Mm-hmm.
right, which you're part of, the school,
Mm-hmm.
ladies and gentlemen, a school-based support team is a team of individuals who are supposed to help your child in whatever he or she needs, right? So generally students who have individual education plan and stuff like that. But I have a question: what is the major differences? What are the major differences between the following three people?
Okay. I know where you're going with this. I already know where you're going with this.
Right. The social worker,
guidance counselor, and school psychologist.
And the school. What? Because I mean, even as a school administrator, I'm trying to put my hand on it. So, what are the parallels and what are the opposites? So you have, what is it called, the Venn diagram piece, right? So where do they connect in the Venn diagram, and where do they disconnect in the Venn diagram? For a parent who doesn't know the difference.
Hey, are you talking historically or are you talking realistically?
Realistically.
I think
any angle you want to answer the question from.
So I think historically, social workers, their primary responsibility is to connect with families and provide resources for families and students. That's the historical social work. So You know, if like, for example, we spoke about like food insecurity, like if a family needed food, what are the organizations in the neighborhood, where can they get that support from? So that, I think, is historically what a social worker has been known to do. School psychologists are essentially, they assess students, because every student has a plan. Some students need an individualized educational plan, or what's known as an IEP. So the school psychologist's job is to assess a student based on a recommendation that could have came from a parent, could have came from a teacher, could have came from a guidance counselor, to see if the student may potentially have any kind of learning disabilities that hinders their ability to be at their best in the classroom. And then you have a guidance counselor where historically, again, it was very reactive, and okay, like, you need support with your grades, you are applying to college, you come to me. All three of those professions can do counseling, one-on-one or group counseling. All three of those professions can do mandated counseling. So if a student has an IEP that says you need counseling, all three of those professions can do that. All three of those professions are mandated reporters. So if there's some kind of suspicion of child abuse or maltreatment, all three of those professions can, if necessary, contact the city and provide resources and support to prevent those things from happening in the home.
Randy, you know, I want to get to a couple of things. You know, you talk about trauma and the impact of trauma. You talk about kids coming from certain neighborhoods, the level of crime, the level of gun violence. You also have the impact of COVID on family and friends, the whole changing of the educational structure in which they know, which they knew of, but it changed overnight. So we talk about these traumas, but also these traumas can consist of, at some point in time later on in life, they become triggers for them to react the way they react. So, you know, I mean, this is what I'm talking about. Today's children in our schools dealing with all the activities around them, communities at home. You know, how do you help them understand to deal with some of these traumas? Just a young one of their classmates being shot and killed, or shootings going on. The parents are separating. So some of these things, how do we deal with them? Because this is today, this is now, this is what's happening with our kids.
Two ways, together and in a safe space. So no one can do this work alone, right? And I think that was one of the, when I first started, that was one of the, that's I think a common thing. I could be wrong, but when you walk in and you're an educator, you're thinking that you have to save the world and you have to do it by yourself. And I learned the hard way that it takes everybody. Every kid does not necessarily connect with me, right? They may connect with the PE teacher, they may connect with the lunch lady, they may connect with the school secretary. And so getting everybody on the same page with being aware with, these are the signs and situations that may be present that this kid is telling you that I need the support. But also, I think it's just allowing the conversation. How many of us have had parents or upbringing where you just didn't talk about stuff? It wasn't okay to express how you felt or any struggles and circumstances, right?
I think Andre said something. It's prominent in Caribbean families, and I know that you come from a culture which is you as a young man, you're stoic, you're focused on certain things. We have no chance to be emotional, to show a soft side, because what we have been taught is that we have to be providers, not so much structurally and financially providing for our families. Nothing about emotions.
Yep.
And that's the Guyanese culture.
That it's not just Guyanese. It's not. It's
Why you
not.
Why you trying to take my
No,
thunder away?
No, I'm just telling you, it's not just Guyanese though. When you think about it,
You always try to take my thunder away.
No.
We're talking about Jamaicans. We're talking about
No, but I'm
Guyanese
just saying
right
it's a and it's not. You
now.
know
Doc,
what?
help me here, Doc.
No, wait.
We ain't
But
talking
it's
about-
not even just Caribbean Guyanese, the CARICOM, but I think I find that a lot in Black and Hispanic families. Like it's not about your emotions; it's really about and then the thing that I hate the most is do what I say, not what I do. That concept, like shut your mouth, go to school, do this, and then you, as a kid, you go, or you get this, you get a strap, right? Which is what you're talking about with we talk about the trauma, right? And
I got hold on. Yo, I got a lot of trauma from the strap.
we all did, you know. That you talk to the shoes, right? That's you know. Yeah, we laugh about it now, right? We laugh about it now, but when you really think about it, that is how we're taught not to deal with emotion. You're a man up, right? Man up. What is man up? You know, you get what I'm saying?
When they go get the vacuum cleaner cord, he said, "Man up, man up, no more."
Yeah, and then they send you for the belt to bust your behind. You know, I mean, like, so you know, it's John. It's a serious point. And so now I ask you a question: is it just Guyanese?
No, no, of course not.
Right. So yeah. So go ahead. Yeah.
I mean, guys, we're also, and I think this is something that people don't think about. You're talking about generational trauma.
Yes.
You know, there are people that, you know, there are Jewish people that still suffer from the effects of the Holocaust. We're no different from the effects of slavery.
Right.
It's just that you don't articulate it in that moment. You don't think about it. You don't necessarily make that connection, but it's very similar. So that do as I say, not as I do, keep your head down, and you don't have time for emotion because you have to kind of make up for all that lost time and all those transgressions.
Right. How do you like when they're busting your behind? They go, am I not talking to you? Say something. You open your mouth. Don't talk while I'm telling you. You know,
right.
Voices go, but so like it's the emotional piece. Like, yeah, I'm not a non-believer in this trap, but I'm also a strong believer in tell me what stupidity or thought process that made you do that dumb thing.
But that requires a prior relationship with your kid too. No, that requires open.
It's learned. So it's like hanging out with like you guys in high school, right? No, I'm dead serious because I realized a lot because as a school administrator, you know, I was in the school system for almost 25 years, right? And pretty much all of it was middle school, high school. So that grade level that you're dealing with, and you realize that you have to allow children to express themselves, which is missing. And I think my relationship with a lot of my students, even up to this day, is, yeah, I was tough, but I was also understanding, right? You could have come to me and say something to me about, and I do that with my kids now, right? You get what I'm saying? And that doesn't mean that I disbelieve in spanking. I definitely don't disbelieve spanking.
Well, you know what, but Roger, you know what? I'm just thinking about what you just said. You know, but I look at our children now and the lack of structure that they have.
And laziness.
Lack of structure in the way they have allowed, you know, electronics and those other things to really take over them and possess them. You know, so it could not have been all that bad dealing. I mean, we could have expressed.
I want to pause you for a second, right? You know,
he's always pausing.
No, I'm always pausing because that's a whole different topic. And I think after Randy goes, I think we need to address that, right?
I don't know if I want to leave while y'all address it because I think
you can join us because John brought up a good point, but we were just talking about the emotional need. Yeah,
the emotional needs of our children. It's important, but at the same time, it's that emotional needs and that conversations that they then feel that they are on par with the adult.
Yeah, that's a problem.
They think that they are entitled. They have the same entitlement as that adult has. So therefore, we don't have to listen to. We don't have to. We can listen, but we don't have to do, because
Who's we?
the kids now.
Right.
I'm just talking about the
right,
kids.
Right.
And the way they look at it. I think it's one thing my father always said. He says, America is a great country, but it gives out too much freedom.
But do you really have freedom?
Mm.
That's a true question.
Well,
It's a whole different topic.
That right then.
Hold on,
Right.
wait,
That's a whole.
Steve.
So I want to add to what John said, Randy, and that is also what I hated. I hated it the most is when you talk about the disrespectfulness of students, because I still believe in my Caribbean way of respect and disrespect. When a parent comes up and they're like, and you see the behavior in the child, and the parent goes, well, you know, this child's my best friend. Right? I hate that, because there's no separation. Or when you call up the parent, well, I know that, you know, again, that's what I was saying. You don't want to go there, right? Because now we have a different set of conversation where you have the parent. It's like you're explaining to, like, for the trauma, for the kid, you're trying to explain to it from whence it came, and the parents will say something like, "Oh, that kid is just so bad," or "The teacher has a problem with my child," and there's no belief in that there is a situation, traumatic or not, that that child has to deal with.
Correct.
Well, maybe that parent is dealing with their own form of trauma,
And they might be in denial too.
Yeah.
And I think on that topic, like, COVID has shown a lot of parents that a lot of conversation that you were getting the phone calls about, now that you're homeschooling your kid,
Now you
you're
know.
now begin to realize, hey, maybe something is going on. Let me get some SBSP, some schools. Let me talk to the school psychologist, the school counselor, and the social worker about what's really going on.
Because now they're forced to
And that
spend
goes back to what you're
time.
talking about.
Right. And now they're forced to spend the time. And I was going to say that for me, being from a Guyanese household, the emotional aspect and the embrace happened when I was in grad school, learning about emotion and how to deal with other people and how they process their emotions. So when you approach,
brother, I didn't learn that until I was in my 30s.
You know,
right.
I said something to my mother right the other day. I said something to my mom, like either this year or end of last year or whatever. We're having a conversation. I said to mom, I said, Ma, you really know that all those beatings didn't do nothing for me, right?
Just to prove a point.
Right. I'm like, you know, right. They really didn't do nothing for me. I was a motivated kid. I wanted to learn. I had my ways. I spoke, you know, that was just me. But all those beatings didn't work. You know what I'm saying? Some of them were effective, but when after a while, you know, beatings didn't work. But at the end of the day, I understood, which is what we're talking about with the generational cycle, right?
They weren't meant to work. They were meant to hurt.
It was meant to hurt. You know, I used to throw salt behind my back and say, I'm not going to get a beating from that. You know, kids, if you listen, throw the salt behind your back, and sometimes you don't get beaten. It's just superstition. The magazine didn't work.
Oh my gosh.
The magazine didn't work.
I have two questions. One, you might not do beatings with your kids, but
question for me?
Yes, and then I'm gonna go to Randy. So, do you find yourself yelling more at them instead of beating them?
I used to. I don't yell a lot anymore.
How old are they now?
The two youngest are 6 and 9.
So what do you do?
Oh, I reprimand, but I don't. I do. I'm not saying I don't ever yell. I'm not, that's not what I'm saying. I'm saying when I find myself yelling, I come back and I consequence out in conversations, right? So
the younger ones or the older ones?
Both of them. But we're talking about the youngest. The others are 20, right? But I mean, I still have conversation with them, but my conversation can lead to, you know, I pay the mortgage, not you, right? So that's clearly understood, you know. But with a 6 and a 9-year-old, it's more about conversations, right? Like when I say to them, bring them to the point of the stupidity of the action.
Stupidity.
I want you to, the stupid. I want you to reason out for me why you came to do that very insane, ridiculous things. Like on a person, my son said something last week, right? He said something last week that was gross, right? I put him on a punishment for a week, one whole week, and he remained on the punishment. And every time he tried to do something different, right, he came back to the punishment. I don't like to use punishment because it sounds so punitive, but it came back to the consequence. Because I made sure that he understood why your comment was so dumb.
Wait, stop right there. So you told him his comment was so dumb.
No, I didn't tell him that.
Okay.
I'm just telling that the comment was I'm talking to you.
Telling you that.
Right.
Yeah.
I'm going to tell you what I would never say that. I would say something that he would understand. Like what led you to make that comment? Do you understand why that, you like really reasoning out with him for him to go back?
Ready. I'm listening to this.
No, I do actually. Sometimes I talk too much, but it works.
But this is so.
But that's new though.
Yes.
And I had to come to that.
No, but the whole point is.
And that's not his children.
But I'm talking about the children.
Mm-hmm.
When we grew up, there was no dynamics.
And that's
there was no conversations. It was fear. But we talk about fear. But you see, we're different than this generation now. They want an explanation for everything. I don't have to give you an explanation.
And I don't have to.
And
I don't want to.
I'm not going to sit down. I'm not going to discuss. What I'm going to do is just like, if they get out of hand I don't yell. I just look at them and then I just grab them. I just grab them by the collar.
And that happens too.
Once I grab them by the collar, there's fear. And at that point in time, I'll just retreat and I won't say anything else to them.
You know,
all right.
The thing that would make me grab them by the collar, and I'm gonna come back to Randy because we're moving away.
I want to ask Randy something.
Wait, hold on, I got you. I'm gonna let you say that right now. Well, make me grab them kind of is a talking back.
Right? Because we allow them to have a discussion. There ain't no discussion.
Right. It's a
dictatorship.
No,
this is not a democracy.
No, but that's what Randy's saying though. Randy's saying that a lot of these children, are going through this dynamic because they're not allowed to express themselves.
They do. That's because it's democracy. They think it's a democracy.
But it's not a democracy. I don't think my kids feel like it's a democracy.
There's no
all
reason.
right, Randy, I have a question. You guys can continue to go back and forth. I wish I had the mute button so I can mute them.
Yeah, I got you.
Going back to
We're done. Go
my
ahead.
question.
I agree with John. I agree.
Thank you. So you mentioned something about psychologist and also school counselor.
Mm-hmm.
So the trauma therapy that you use, would you find psychologists using the same thing or no?
Maybe not necessarily school psychologists. I think I don't think that it's like again, it's not. I don't think it's like something that everybody necessarily is trained in or does. I know that the therapist that there's another therapist that I know that does it. She's actually at LCSW, so she's a licensed clinician social worker. Okay. So it was something that, again, like she got trained in it as well and just added it to the toolbox.
So here is my concern. When you are providing the services, are you by yourself with the child or is there someone else? By
yourself. Counseling sessions, there's supposed to be confidentiality.
Okay, so if they're going into, you call them trance, you hypnotizing or whatever, do you find more? I would be concerned because it's a school setting.
For you or concerned for your child?
Just overall, because it's a young person. Mm-hmm. So that's why I asked, would someone else be there? Because hey, they might, they're out, and you don't know what tends to happen. So I'm surprised that they actually allowed this to happen.
When you say they're out, what do you mean?
They're being hypnotized, correct?
No, but that's exactly what I don't want everyone to think about EMDR. It is not hypnosis. EMDR is no different than someone telling you, when I was 8 years old, someone got hit by a car in front of me, and it is a traumatic experience and prevents me from getting into that kind of car. It's no different than them being able to articulate that.
So how do you, but I going on Dr. Brian's question, right? How do you, what is, so what, because I'm a little bit confused too, Dr. Brian, right? What gets them to that point,
right?
That it's not hypnosis, but there is some kind of method that get them to the point to go back and recollect that memory. So what is the method that allows them to what is it called, that recall?
So you're talking about the desensitization. So it can be in a number of different ways. Some people use there's I forgot the name of the machine, but it's like a light machine where essentially you're following the light from left to right. So essentially, and I'll send you guys some material on it as well. So because I think that I'm not going to do it justice by explaining it in an hour, right? Something that you have to read about.
That's the question. Are they alert? And
they're not. They're alert. They're not like you. You're not gonna walk into a session and they're like sleeping or not cognitive of what's going on and stuff like that. It's not hypnosis at all.
Right.
Yeah. So essentially, what you're trying to do is activate the distress by what's the terminology I want to use? So the eye desensitization is you're just trying to get the memory out. So you're not like shutting the person down. You're like, there's this thing that is behind the scenes that's affecting me. How can I get it out so that we can discuss it, so that we can connect it to the trauma and what it is that you're going through. So it's not like you walk in and they're like completely in a coma or whatever the case may be. They're active, they're talking. It's very similar to talk therapy. It's if you're talking about like if you're using like, let's say, Erickson's psychological development stages, or if you're using Gestalt theory with an empty chair, they're alert, they're talking. It's not something that kids are like comatose and unalert or unaware. And if anything, the grounding techniques that are embedded in the EMDR prevents that from being hypnosis, or what people feel like is you're in the psychotic state or psychocoma or whatever the terminology is.
One more question in regards to, for example, if I am claustrophobic, would that be something that you would dig or use this method to find out what would cause me, every time I get into a certain space, hey, I start getting nervous or whatever? Would that be something that warrants this type of therapy?
But being claustrophobic doesn't how would that affect?
Just the example, just the example, claustrophobic, or certain noise, or if somebody's standing behind you, you get nervous and you start jumping up. Would that warrant something to dig deeper?
If you wanted to do EMDR based on claustrophobia, that wouldn't necessarily be someone that wouldn't be in the school setting. That would be like an outside social worker or a clinician. Like that wouldn't be associated with school necessarily. The trauma that I would kind of work towards is, again, like something that's causing like anxiety, something that's causing uneasiness, stuff like that. But if you're talking about, like that's, I feel like that's more like an adult.
Randy, just to jump in on that, the point that you just raised, when I look at, when we talk about police brutality, we talk about the George Floyd incident and other incidents, the Aubrey incident, the trauma that we as people of color associate with interactions with law enforcement. you know, what's your position? How can we talk to them, and how can we change the culture and policies of community health? Like what are the? How can we change the paradigm? How can we just change the conversations? How can we change our outlooks? How can we get rid of the trauma that we associate anytime there's interactions with police, that we have to
and
be
the negative,
the negative connotations,
especially from young people.
Especially for young people. However, when we always when we sense danger and we sense fear, we always get on the phone and call the police to assist us. So how do we juxtapose one against the other?
Empowering, and this is going to be, you know, when you guys were talking about allowing your kids to be able to express and have conversation, there's a parallel to this as well. Like, you, in essence, you're picking and choosing, but again, like you guys said, that's another conversation. But it's the ability to express and explore and to have the conversation and let it be known. And I think we're in an interesting time where it's a horrible time, obviously, with all the deaths and all the murders. Mm-hmm. But it's a good time that, you know, people's feelings are being validated about it. Like, I remember, you know, my dad, it was always and this is like a training 101. It's like, avoid the police at all costs. The police are not necessarily a friend, which is the opposite of someone who's not a person of color, where they're expected to go to this person. And I remember we were actually walking from high school, being stopped by me and my friend, two police officers, and they asked if we wanted to be in a lineup, and we're like, why would we want to be in a lineup?
Wow.
And they were like, oh, you know, like you can, you know, we'll give you guys $20 to be in this lineup, and we know that you guys are not the criminals, but we just want to make sure by having a lineup that we have the right person.
Fillers.
Right. And you know, from that conversation with my dad, it's like, all right, they're not my friends, and therefore I'm not going to go with them or whatever. But just the idea of like, how does that happen? And that would never happen to someone that didn't look like me. So I think, to answer your question, it's the conversation is out now. It's about having our people feel like they're empowered to be able to have a voice to do something. Because for a long time, we felt like we couldn't do anything. It went unsaid.
Because they did not want to hear us, because they did not see us. They questioned whether it existed until the people started using these cell phones and these videos and actually seeing what happened. You know, the whole George Floyd incident. They saw it actually a police officer abusing, and there was a consensus. Finally, you know, we got an affirmation of what we've been talking about over and over and over. This has led to the trauma that we experience, the triggers that we have experienced, which trickles down to our children when we try to educate them about.
But to your point, people like our kids will be able to access information, and that goes back to, you know, you guys talking about, well, I don't necessarily want to have to explain myself to my kids. We live in a world where they're getting explanations whether you're explaining it to them or not. And the bad part is that they're getting the wrong explanation and assuming that it's right. And they're questioning everything. And it is probably the most annoying thing to be questioned. But the questioning is not necessarily from a place of disrespect. Questioning is purposeful, because we teach our kids. And if we don't teach our kids, then somebody else will. And that's the internet. And the internet can put some crazy things in your kid's mind where perhaps they are, you know, kind of watching and seeing and thinking that things are what they think they are. And without any kind of open communication or conduit to even be comfortable to have a conversation, somebody else is going to teach your kid. So
I want to.
Tamika Edwards has a question. She says, is this similar to the effects of a sensory deprivation tank, kind of minimizing external stimuli?
No, but it is focusing on the grounding part, because a lot of times the anxiety is like psychosomatic. So you may feel your anxiety and stress in certain areas. So it's about being able to be grounded to isolate where that part is affected, and then talking through where the stressor came from that may be affecting that part. So it's not necessarily sensory deprivation tank, but it is more like when we think about it, like how many of us take time to just meditate and like kind of like just be in the moment of focusing that your feet are on the floor.
True.
Hardly anybody does that.
Good,
right?
Very good point. Yes.
So it's more the grounding part. We're used to going and moving, and to Rudy's point with COVID, it forced everybody to stop. So yes, there's anxiety with having to deal with a pandemic, but there's also anxiety coming from not doing your regular scheduled program, which allowed you to ignore a lot of the things that may be potentially bothering you. And so that's why you see an uptick of anxiety, depression, sadness, independently of the realities of a pandemic.
So when we talk about trauma and the effect on people, California recently said one of the school districts, and usually what I find is that once it starts someplace, it's going to end someplace else, right? So in the Los Angeles Public School District brought up that children 12 and older must be vaccinated. Right? Say it again. Oh, to be vaccinated, period, to come to schools. And there's a deadline for that to happen. And recently, well, we're talking about children, so I'm going to leave the teachers alone with that conversation, right? That's going to create even more trauma that you're going to have to deal with as a school counselor. What's your take on that?
As far as being forced to be vaccinated?
Yeah. Well, not just being forced to be, but because now remember, there are two sides to it, right? There is the reality, right? And I talk about it all the time with kids. A lot of your children, like you just stated, like have lost many family members to COVID, or they know somebody's family who lost somebody. But on the flip side of that, you hear a lot of negativity around the vaccine and what it can and cannot do, whether it's proven or unproven on either side, right? Because sometimes they say the numbers of COVID is unreal, right? But if you ever talk to somebody who has been truly affected by COVID, they're gonna make sure that you know that it's real, or if they lost somebody to COVID, and tell us real. On the same side as the vaccine as well, right? Because like today, I really got another WhatsApp with, you have the WhatsApp doctors, and they sent me the message about the person being paralyzed from taking the Pfizer shot, right? Yes, I guess I'm showing my bias, right? But at the end of the day, they really have, and the fear is real. So whether it's true or not, it's a fear, and fear is real. What are some of the things, or have you seen that already? So what are some of the things that you have done or plan to do as it relates to both sides of the aisle? The kids who are because you know what, you have other kids who actually fall in line with their parents and say that you need to be vaccinated, you need to wear a mask, don't come near me. You understand what I'm saying? And who's going to ostracize their friends because they're not vaccinated or they're not wearing a mask. While the flip side, where you're going to have those friends are going to say, I'm not going to be vaccinated because. Have you come across that? That also in itself is going to cause some kind of psychological demise, right? Either you could lose your friends or whatever the case is. So talk to us about that as a school counselor.
So I haven't necessarily come into direct contact with that. The thing that I've been dealing with, because school hasn't started yet, right? So that scenario hasn't happened. But what we have been dealing with is, okay, so I don't want to be vaccinated, and there's a lot of questions about, okay, well, like you said, in LA, they're saying everybody has to be vaccinated. NYC is probably up next, right? Biggest school system. It's been more about like, well, this person's not vaccinated. How do I know? So on and so forth. So
as you sneeze, you go COVID.
Exactly, right? Or cough, and everybody's uncomfortable. So we've engaged the parents and the students in a conversation because we have a school-based health clinic with just a presentation about kind of the facts. And because the thing is, and this is where we have to be careful as educators, is that we don't necessarily know everything. We're not the doctors. Like you said, our COVID experience is our experience. It's not necessarily everybody's. And so I think that educators have to be mindful of their biases. And I think John alluded to, like, and this, I guess, is connected to the racial tension work. So one of the things that we've done in our school, we have a committee on racial equity, and we actually had teachers explore their biases related to race, right? And I think the same thing can be applied to their biases regarding the vaccination. Because I think right now there are a lot of teachers that are salty because now the union is requiring everyone to be vaccinated come September 27th. And you know, it was a back and forth, and some people were actually happy that they didn't have to be, but now you have to be. So it's about, as a school and a system, checking people's biases and making sure that information, like, is coming from both sides. So you're getting the information from the medical practitioner, and we can't stop the students from getting the opposite perspective. But I think that both perspectives are worth hearing, and then allowing, because and the thing is, the student is controlled by the parent, right? So at the end of the day, that's another component of this, because the student may feel, I want to be vaccinated. And I've had that. I've had a student that said, I want to be vaccinated, I'm thinking about it, but my mom is adamant about me not being vaccinated. So there is like a multitude of different or going to be different issues this school year. And you have to treat it the same way you would treat, you know, bullying.
So you're not vaccinated?
Who?
You?
Of course I am.
Oh, okay.
But you would have to treat the same way you would treat bullying and any kind of like school-wide issue. Is information, educate, and ultimately understand that, you know, folks are going to make their own decisions, and you can't necessarily control everybody's decision, but you still have your own protocols in place to cover the myriad of whoever is thinking whatever they're thinking. So everyone has to wear masks, HEPA filters, filtration systems are updated in school systems. Our next week, we have kids doing a staggered schedule. Our first week is not focused on academics at all. It is about getting to know you as a student, and also acclimating you with just being in the classroom and going from class to class. 18 months is a long time to be out of the building, and that process has to happen, because I think people may assume that, and I think that's just a general consensus. People are just like, oh, we're back to work, back to business as usual. That's not the case. So yeah, it's going to be a lot. It's going to be a lot this year. It's going to be all hands on deck. Your question about school psychology, social work guidance, we literally are like, all right, we need to, you know, we need and say, this is what the year is going to look like. What are the protocols and steps in place to react to different situations? And also, how can we be proactive? Because we know that it's coming. We know that cough in the classroom is going to trigger so on and so forth. If we can educate and have the conversation with the students before and get them to be a little bit more comfortable, hopefully the transition is going to be as smooth as it can be. I'm sure it's not going to be smooth, but as smooth
Randy,
as it can.
you know what, Randy, and you know, just you're on point with what you're saying, and hopefully, you know, our villagers take heed to what you're trying to say, and the impact that what you do can have on a young person's life. So I just want to say thank you.
No, thank you. Villagers, please do not be afraid of EMDR. Obviously, you have to be trained in it. It's it's not a YouTube and go. It's again, and it's not the silver bullet. That's what I want to stress too. I think people want to find like that magic thing that'll solve all issues. And the thing is, we're not dealing with numbers, we're dealing with people. And everybody internalizes stressors and anxiety in different ways. And you know, utilizing different tools can be beneficial. There's not one size, education is not one size fits all, even though unfortunately for a lot of, you know, places it really shouldn't be the case.
Makes sense.
I'm gonna hypnotize you right now, Rudy. I'm gonna hypnotize you right now. I'm gonna make you think that you are 41 instead of 61.
You need more than hypnosis. You need more than hypnotizing.
To get me back to
you know,
my
Randy,
right age of 49. 49. All right. I might look like I'm 61, but I'm only 40. And unlike everybody else up here, I'm retired. All right. So
I'm not retired. You said like everybody else?
Unlike everyone, I am retired. And I retired at 47.
God bless the retirement,
right,
of Mr. Rudy Daly.
Jealous.
Randy,
Jealous.
yeah, definitely.
Oh, don't be
jealous of nothing. But Randy,
yeah, don't be.
I just want to say thank you, man. You
Yeah.
know, and your folks are proud of you for the person that you have become, and we look forward from hearing you more. Hopefully, again, you come back on the village and hang out with us, villagers.
I hope so, man. I hope I'm able to actually use EMDR.
Mr. Daly.
Yeah, and thank you. Yeah, for standing out and being a wonderful Black male counselor, so that our kids have someone to strive and look up to when they need to reach out to. So thank you.
All right, and yes, and continue to make me proud. You know, to know that you were my student. These other two up here, like these other two who can't say their student came out to be nothing. I know.
Stop.
Hey.
Cut it out. Cut it out.
Randy, Mr. Bowen, they've been knocking me all show, right? So it's my turn now, right? Tell me how old I am.
So I'm gonna have a couple of my former students reach out to you.
Well, then I hear right now, right? Mine is right. Mine had an article written about him.
Please unplug Mr. Daly's microphone.
Thank you, Randy, so much.
Yep. All right, guys, take care, man.
Congratulations on the newborn. How many is that now?
Yes, congrats.
First one.
Mm-hmm.
Congratulations.
You see, you're 49, you can't hear.
Take care, guys.
I can't say what I need to say in there. Take care, Randy. Yeah, man. There's so many things going on. You know, that's great to know. Really, I mean, on this show, John and Joanne, we talk a lot about the psychology, the mental issues that happen with young people, and these things that lead to crisis. Right? I'm sure Dr. Bryant deal with them in school, and I used to do it. And Andre, deal with them in school where they're literal crisis that happens. Students become suicidal. You know, they don't want to go to class. When they go to class, they don't perform because they really are going through trauma, right? And it's glad to know that somebody like Mr. Bowen is dealing with that and using the method of EMDR to focus and bring children back to address and deal with the trauma. And like you say, Dr. Bryant, you might feel a little uncomfortable with it. I might feel a little uncomfortable with it, but it's one method in dealing with some of these crises because our kids need to learn. A lot of our kids are, behind, right? A lot of kids are behind in school. When you look at the educational gap, right, it is ridiculous, especially when you look for children of color. True. When it's blacks. I'm not blacks. So you have Chinese and whites who are at this level, and then you have the blacks and the Hispanics are at this level, and the levels are not even close. They're like they're double-digit points and high double-digit points in between. And a lot of these things that happen from, like you said, like generational trauma, that has happened. So I'm glad for that.
Yeah, I'm glad that we had this conversation this evening, especially with children going back to school, some parent anxiety, with the changes, with new regulations, with new mandates that's put in place. So it was a great conversation to have and to continue.
All right. And John, listening to you is a whole different conversation between dealing with the trauma and dealing with the disrespect, right? Like we were talking about what we encountered as children and how we also want our children to address us. But I think I think there's a fine line, right? Well, there's not even a fine line. There's a line between being abusive and being a disciplinarian.
Yes, but then society jumps in when we try to
Because they don't
discipline
have
our
no
children.
they don't have no kids.
And then the next thing you know, we're being pulled into family court, locked up, or whatever it is, because of the discipline that we administer to our children. However, when they get caught up in the system, and
It's our fault.
then not only our fault, they then have the opportunity to administer that discipline that if we administered when they were young, sometimes maybe 99.9% of them would have never went down that route. So it's a combination of consistency when it comes to the level of 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 uh, of dialogue that we have with our children. I can understand we want to educate them, but at some point in time, it's no longer a democracy. It is no longer a democracy. It's a dictatorship, because what my father always told me, he said, son, you may have all the education in the world, but I have the experience. And experience trumps education all the time, because it's that experience that educates you. You know, this is something that the void that is missing in our communities. And you talk about whites and you talk about the Asians. It's discipline. It boils down to discipline. Family. There's so many other factors, but it boils down to discipline.
But the question that it's not just discipline, Joe John, but the question is what kind of discipline?
Well,
right.
It's discipline, and there's ways in which there could be structural discipline.
Right, because
there could be there can be spiritual discipline. There's many different forms of discipline, but the whole point is to center and focus our children on something other than being mischievous, other than getting involved into these gangs that exist out there. You know, but some of them don't have that structure, that family structure, that family unit, and then you go into communities and the community doesn't have it. So who then fills that void? That void is then filled by those gangs that are being involved. Obviously, there's a level of, because of the lack of educational know-how, they are so frustrated, and they put that front up when dealing with people. And the only other course of income is because they can't do anything else but to engage into criminal activity.
You know what I find is sometimes, like, parents think that sometimes parents go, I don't know why my child joined the gang. I don't know. Like, you know, I shared the story with you, right? And I talk about the story all the time. And many years ago, while I was at South Shore, I called up the parent and I said to the parent, no, not called up parent. The parent came to parent teachers conference. Mm-hmm. And the parent, I said to the parent, you know, your daughter is a good kid, and you know, but you know, her mouth is dirty, right? She curses a lot, and I'm tired of talking to her about her cursing. And without shifting left or right, the backhand went right to the girl. It's like she knew exactly where the mouth was.
Oh yeah, boy.
But here's the problem. The slap didn't bother me. It's what the words that she used that bothered me after. Because she used the words, who the, you fill in the blank, taught you to speak like that.
Who the MF taught you to speak like that?
Right? And
really?
She used the MS. She didn't use MF, but she used something similar. So at that point, I didn't even bother with the conversation anymore. Because a lot of our parents, and they don't understand the mental anguish that you're giving to the child when you say the terms. There are a couple of things that I hate when parents say. One, do what I say, not what I do. Nobody follows that, right? No kid follows that stupid rule, right? Every kid follows what you do, not what you say, unless what you say and what you do are parallel. If they're consistent, then yes, they will follow it. Like if you're a person of your word, they will follow it. But you can't tell your kid you shouldn't watch so much TV, and then you go to the room and watch a whole bunch of TV, cat in the room. What do you think the kid's gonna do? watch a whole lot. Or go read. Well, you never take up a book, right? Sometimes you have to read with the child, right? If you're not doing that, that's not happening. The second thing that I hate when a parent say is, don't worry. When you're 18, you got to leave my house. When you were 18, whether you left the house or not, how prepared were you to take care of yourself?
That's the point. Preparation.
Right? How prepared were you at 18? And not to mention, generationally, right? Generationally, how different was it? You get what I'm saying, John? Because now it's funny because I was having a conversation with my son today, right? And he's a baseball player and he's sitting there watching Roblox. And I said to him, we were talking about because some of the athletes, like what they were getting paid now versus what they were getting paid 20, 30 years ago, right? And I was saying, what's the net worth of Reggie Jackson? Reggie Jackson's net worth is $20 million. What's the net worth of Derek Jeter? And his net worth is $200 million. But Reggie Jackson and Derek Jeter live about the same life.
Right.
Because when he was, I think he was the first baseball player to sign that $1 million contract in 1977, 78, right? So $1 million in 1978 is what $40 million is today.
Amen.
Right?
Amen.
Understand what I'm saying? So I was trying to explain to him that so 18 years ago, if you're 18 when you had that child, that 18 years ago, 18 years, if you look at the mean salary 18 years ago, it probably was about $20,000.
Right.
Or, I mean, on the poverty line. Now the mean salary is like 30 something, 40 something.
Right.
So the numbers are different. So when you were 18 and you were struggling, or 19 or 20 or even 21, and you were struggling, you really think telling your child that when you turn 18, you're gonna be on your own? What do you expect from the child? Now, if the child feels that I'm 18, 19, 20, and I'm good to go, hey, that's the door. Like I tell my kids, you're allowed to live in my house until you're 25. I want to make sure that you do certain things. But the moment you step through that door, rest assured you ain't coming back. If you think you're man enough to go through my door because you think you can do whatever you need to, then you're staying outside of the door. That's different. I'm not putting you out. You're choosing to leave because you think you're wrong. Thoughts, comments? For some reason, Dr. Barnes, you're breaking up a little bit.
Okay. Can you hear me now?
Yeah.
Okay. So I want to
You going again?
go back a little. Okay, give me a second. I'm gonna log off and log.
So, what's your thoughts on what are your thoughts, John, until she comes back?
Well, my thoughts continue to go back to the lack of discipline and structure that our young people exhibit, and that could be a learned behavior from what's going on at home, or learned behavior of what's going on in the street. But what we need to do is there needs to be an understanding that can only be manifest, and you might be right, can be manifest through dialogue with our kids. Dialogue to hear about their issues and concern, but at the end of the day, understand that I will allow you to discuss with me, but I make the final decision.
Yes.
We can give them that opportunity to do that and just say, this is the final decision. We will allow you to be heard. We will give you our due process. At the end, we're going to make a decision that we feel that is in the best interest of you.
You know what I tell my kids?
What?
It's just like what you said. I'm gonna hear what you're talking about, right? And because you ask something, I don't have to agree with you, but I can hear what you're saying. I don't have to agree with anything you're saying, but I'm willing to hear you out. But like you said earlier in the conversation, what your parents used to say, experience is the greatest teacher. So when you combine you combine the you know, what would you rather take? Who would you rather take your car to? The mechanic who has 30 years experience working on the car, or the person who just came out of school, right? Or who knows all the parts but have no practical experience? Who would you rather take the car to? And I'm going to take the car to the 20-year. I'm going to feel more comfortable
with a 30-year
with a person who has 20 years experience.
Mm-hmm.
And that's just how it would work for me personally.
I think it works pretty much for all of us, but we have come to now that a culture that talks about dialoguing with our children, explaining to them what's going on, explaining to them timeouts. We didn't experience those things. That's why, excuse the expression, a lot of parents are catching hell now with their children because of the lack of discipline and structure that they have been administering to them. They allow them to be their best friend. My father said, "You are a child. You're not my best friend."
And you stay in the lane of a
and
child.
You stay in that lane. You stay in that lane. So these are the things, my villagers. But what do you think about the new governor?
Well, before we even get to the new governor, today, our guest from last week, Senator Brian Benjamin, has been sworn in as the. I forgot what number it was, Lieutenant Governor. I don't remember the number.
Correct, the Lieutenant Governor.
So congratulate. First of all, we do that by congratulating Brian Benjamin, who for becoming the new governor, right?
And also,
Lieutenant Governor.
Also, just want to give a shout out to Senator Prasad for assisting us getting him on the show.
Absolutely.
Last week,
I didn't even call her until I thank you.
We appreciate. I did that for you today.
Oh, you did that for me today.
Yeah,
I
did that for you.
I
So
appreciate
I want
that.
to say thank you and just say on the show. But we expect the Lieutenant Governor to come back because there's other issues that we have to talk about, especially, issue that has been really hitting our communities and we haven't been paying attention has been the lack of insurance coverage that some of our dollar van drivers have because of an issue that is going on at the Department of Financial Services up in Albany, which is preventing a company, a insurance company who has been providing insurance for these dollar van drivers right now has challenged them and thus has hit them to the point where they can no longer provide insurance for our dollar van drivers.
John.
But there's nobody
I do think that we need to get them on, and it's not even just the dollar cab drivers, right?
Mm-hmm.
It's New York City residents with insurance,
right.
Because the rate of insurance in New York City is ridiculous,
outrageous,
right? It is outrageous about what they're doing. So the dollar cab driver, which is an economic means, you shouldn't go out and work and actually coming home with money that's not even able to take care of your bills. That doesn't make sense. And you have no security. It's no job. There's no job security.
No whatsoever, my friend.
So yeah, you're right. Maybe we can talk about that some more.
Then another thing that's been going on, this whole moratorium. This moratorium has been pushed back to
moratorium on what?
The rents.
Okay.
January to January of next year. My whole point was the impact it truly has on the small landlords. So it's amazing. In what's another topic?
Amazon said they're gonna pay full cost of college tuition, fees, and textbook
for what?
U.S. hourly employees.
So now we're talking about Amazon, ladies and gentlemen of the village.
Starting January 2022, they said they'll cover the cost of college tuition, fees, textbooks, operations, network.
Andre, let's go. Let's hear it, man.
Tell us a little bit more. Yeah, don't be so.
I'm just giving you
yes.
Some of the stuff.
So, but I can't hear you.
You're part of the producer.
Producer.
So let's go.
Yeah.
Produce.
I am having a wonderful technical issue, so
I'm sorry. Fix your computer. I know what's okay. I'm just bothering you.
Hey, Doc. Stop with the bootleg computer.
Can't hear you.
And
all right, so I'm gonna have to leave again. Forgive me.
Where
Gotta
you
leave
going now?
again.
Oh,
Oh,
well, she's gonna
Doc
get
gone.
Yeah, Doc is like me last week, right?
Doc's a
Got
ghost.
ghost, right? So you were saying Amazon. Well, actually, they had that before. Amazon and other like some other companies like Target and other things have tuition reimbursement. Actually, you know what I like about Amazon is all. I did a lot of things I dislike, but a couple of things that I like. That they actually give you a pension. If you're working with Amazon, you actually get a pension. You get a pension plan. You get a 401k.
Beautiful.
And so like I was telling my son who works for Amazon, I said, hey, you need to jump, and he's only 19. So I was like, you need to jump on that, because by the time you finish college, you become 5 years vested, you're gonna get a pension for life.
Yes.
Right, whether it's $100, $200, $300, it adds up, right?
It's a reoccurring money stream.
Yeah, yep. For the rest of your life, you're gonna get that. So and he looked at it and he's like, "Oh, I have this much money in it already." Like, yeah, that's how the pension works. So, really excited for him. Hopefully, he stays with it for long enough for him to become. I'm trying to teach him what it means to be vested and not vested.
It's
stuff
important,
like
man. Roger, you're a good father.
that.
I take back everything I said. You're a good father.
I'm
Kumbaya.
I want to kick him, but I can't kick him because
you kick me when we call the police.
Yeah, you can't bring the police into the black community, right? Joanne, you were saying something before you got disconnected. What were you saying, Dr. Brown? Do you remember?
No, you
to another topic.
Shout out to our. Can you hear me?
You keep breaking up. I don't know what's going on.
You can hear me? I have no idea. All right. No. I think you touch, given our friend who came on last week a shout out, and I think you actually did congratulate him on getting his recognition and being sworn in today. So very proud moment.
You want to hear something funny?
No.
What is that?
You ever see the that T-Mobile commercial where they were saying that what she actually heard was, don't worry about the party. She wants to break the turkey. I said, do you want anybody when she comes in a costume? Yeah, I don't know if you remember that. There's a commercial, but anyway, go home and look at it. She comes home. She comes to the party with the costume on, but what she really heard was, it's a costume. Don't worry about it. It's a costume party. When she said it's really not, and so that's what just now you said congratulate, and it sounded like adulate. So just thought I'd tell you that. That's why I brought it up. But yeah,
what the hell are you talking about?
No, when you listen to commercial, because you're breaking up, all the words don't come out, so you can't hear it. So now she was saying congratulations to the lieutenant governor, and it didn't come out as congratulations. That's
came out as what?
Like adulate or something. Like the rest of the word, like adulation or some other word. But we could go back and roll the tape and find out.
Roll the tape.
Okay. All right.
I do want to jump on this. Our one of the actors, Brooklynite.
Michael,
I have to shout out to
to his family. Yeah, Michael Williams.
Michael K. Williams.
Yeah,
passed away. Yeah. All the way because.
Go ahead, finish up.
Go ahead.
No, you were saying.
Not only was he an actor, but he was an activist as well, and he created so many different avenues for children, for young children, for teenagers, for people to stay off the street and to keep out of trouble. And in fact, it's such a sad thing that who do you go to when you're struggling? It is a battle he dealt with, and he was public about it, about dealing with drug usage and things like that. But who do they turn to when they need help? You're being the superwoman or superman for everyone else, but when you need support, who do you reach out to?
Yeah,
and what? How? Go ahead.
No, go ahead, Doc. I'm sorry. I want to interrupt. Go ahead.
How does the industry support people who are struggling? Because when they make it verbal, Yes, that's one part, but support needs to be on an ongoing basis. That doesn't mean that they actually won that battle, because many entertainers will entertain us day and night, will bring it on, but they're dealing with their own trauma. They're dealing with their own demons, and just being tired of saying, oh my God, this was a great person, and then they're dying to drugs or they're dying to something traumatic. So it's such a sad way to just look at the whole picture. He's doing something, but he didn't win his own battle. So
Yeah, John, I was saying that he was on the wire, and one of our fellow alumnus was also is one of the stars on that show as well. The Wire, Jamie Hector.
Jimmy Hector, yeah.
Yeah, says you went to my 11 as well.
And
so
also,
I'm sure that he
member of Christian Cultural Center. Yep,
yeah,
Jamie Hector. Yep.
Yeah. So, I'm sure
Jamie.
Jamie.
Wire was one bad show. Everybody was scared of Omar.
Yeah, that's
remember that. Why you watched the Wire, Doc?
not really, no.
All right, Doc.
I'm sorry, I was too busy studying.
Remember that word. Remember that. No, it was on before you went. You're in doctoral school.
Really?
Remember what was that word I told you before? That the acronym that I told you when you were on the show and you had the hip. What was that word?
I don't know.
Grok. Gradual release of control. When you make a statement so soundly. That's like, I don't want to watch that. That's not a gradual release.
No. Because the thing is, there's other things I've watched where he
we're not talking about that. We're talking about what John said about The Wire and how you quickly responded to it in a negative
I don't watch
fashion.
it. No, I did not respond in a negative. Just because I say I do not watch it doesn't mean that it was a negative fashion. I don't watch it. I'm sorry. I was too busy in the books. I'm sorry. I don't have time for that.
It was before you were in the books. That's the point.
Excuse me?
Yeah.
Not really. You can't say.
When was The Wire? When was The Wire? When was The Wire? Because that was your defense. When was The Wire? When did it come on?
You know what?
When was The Wire?
Listen, I'm not going to even go back.
No, answer the question, because you said I was in my book. So when was The Wire? Go ahead.
I'm not going to go back and forth with you.
That's Grok, right? Because The Wire was before you were in doctoral school.
Really?
Yes.
When was I? Okay. All right.
No problem. All right.
I'm not
I'm sorry. Our producer's telling us to move on. What is it? 11 people said yes. Oh, we were talking about. Wait, go back.
We won.
Okay.
Come again.
When we were going, remember we were having, on the side show, ladies and gentlemen, we're asking a question, and if you're here now and you didn't participate in the poll, because there was 190 people who actually looked at the poll, right, from on my page, right? 190 people actually looked at the poll, but only at smaller, less than 20% of you answered, right? So if you want to give an answer now to help us out. So the question is, do you plan to or know anyone who's planning homeschooling their children, right? So on the poll, the numbers shrank a little bit, which said today was 67% that said they knew somebody or they plan to homeschool their child, right? And now it's at 50. What's that? Now it's at 65%, 35% that said 65% of them said yes, and then 35% of them said no, they don't plan to homeschool their children. So I'm wondering, but you know what? We were talking about this in our backstage meeting, just like with the vaccine, right? And that the majority of there's about 48% of Americans. A number might have been. Can you pull that up? See if you can find it. The percentage of Americans who took the vaccine, right? And the percentage of Black Americans who took the vaccine, right? So you're looking at maybe of the 100% of people who took the vaccine, you're looking close to 50%, 60% of them are whites. And a larger number of people who don't take the vaccine are black. So blacks on a larger average don't take vaccine. I think in Texas, and I was listening to some of the stuff, and you find, for whatever the reasons are, like whether it's because of certain experiments or the feel or the fear factor. So I'm curious to know of the 65% who said that they know somebody, they themselves or know somebody. I'm curious to know the cultural makeup of that, right? So let's see. Reasons include concern about COVID, the vaccine, not trusting what has been fed to their children. Some have been homeschooling for years, right? And they will continue their process. So that's a very interesting conversation, right? Why are we more, as people of color, have, whether it's innate, habitual, trained, whatever, why are we disparagingly greater at fearing the system, but and also at the same time, right? So our kids are the numbers of our kids who are succeeding is significantly less than our white counterparts. And the fear factor also is significantly higher. So is there a correlation? I don't know. I'm just throwing the question out there. What do you think, John, Joanne?
Go ahead.
What do you guys think? What is there a correlation, really?
Between what?
Between our fear, right? We are a higher percentage renters than owners.
What you saying?
I don't know what the fear. I don't know. I don't know. I really don't. Maybe we should ask Randy about.
What we fear is the lack of opportunity that puts us in a position
where
we have no more fear.
Do you think? Okay, so as a school administrator, right? As a school administrator, I had two different programs that I dealt with, right? I had two different programs. I had the program where I'm dealing with students with excellent grades and putting the program to try to excel. And then I had a school where my 90% or even higher of my students were Black or Hispanic.
Right.
And in both settings,
right,
the students who failed the most were my students that were Black or Hispanic. So like one of the programs, right, I had over 200 kids on my attendance, where more than 50% of them were Black and Hispanic. About 70% of the Black and Hispanic kids did not show up or did not want to come to the program, whereas about 80% of the white and Chinese students actually came to the program.
Right.
So it's and I had every excuse from the parents. Oh, my kid doesn't want to come. Oh, it's too far. I don't want my kid traveling by themselves. Dr. Brown, you know what program I'm talking about, right? I don't know if you saw the same kind of numbers at your program, but your program was had more students of color in it. But the success rate of our students of color is so poor with the same opportunity, because it is the same opportunity.
It's the same opportunity, but the foundations to get.
I don't know if I'll say
Wait, she's saying something. Let me hear what she's saying. Go ahead, Doc.
I don't think it's the same. See, certain culture will start preparing their kids as soon as they're 3, 4. So we go back to that. You know, the mentality that they put in place and ingrain in place is from 5 years old. This is what you're going to do. This is what you're going to go. This is where we don't start talking to our children about certain things until later on. You know, hey, when they get to middle school, or hey, when they're about to graduate out of elementary school. Oh, you know, you want to consider this. So we're actually a little backwards and we're behind. We fell behind because where exposure is given to kids from a different race, different, you know, and it has nothing to do with, it could be economics as well. They're exposed to more things than our black and brown kids, Hispanic kids. Some of them don't even leave their borough. Better yet, go on vacation or do multiple things, or like you mentioned, skiing or surfing or things like that. No, exposure also have to do. Many parents are doing survival, trying to keep a roof on top, so they don't have time to pay for tutors and things like that. So a lot of different elements play a part in our success rate because it's not even across. So
Okay.
I would
John.
say
Oh,
that.
our producer wants us to read something. Let me just read it real fast. Why I can't say that? It's you. You're the one who's pointed out to me. First day of school was today for a lot of schools, and more families were considering remote learn. Oh, the first school in New York you're talking about? Okay. And because the official first day of school is Monday for New York City. First day of school was today, and more families are considering remote learning more than in person, despite the struggle in remote learning last year. And ABC article cited the CDC changed the masking guidelines on July 27th. If you're vaccinated, you still had to wear the mask. That changed so many minds and possibly caused an increase in hesitancy and fear. That which is going back to what we're talking about with the poll. John, what Joanne was saying about the lack of access. Is that what am I getting that right?
Lack of access
at a younger age is part of that issue. What's your thought on that?
Most definitely. Most definitely. We are not, we don't go beyond the 4-block radius or the 2-block radius of our communities to venture out to understand how other people live, how to understand that although you may be born in poverty, does not mean you have to stay in poverty, because they see nothing else but surrounding them. Once they get out, once they travel, I always ask my daughters, when they go to school with their friends, and their friends come back from a break, or our kids talk about the latest fashion. I got the shoes, I got the this, I got the chain, I got
or
this.
what's happening on
But
this television show.
Well, I said, when you ask her classmates, what y'all? Oh, I went to Europe, I went to the Maldives, I went to China. Basically, all those outside of their element. Our problem with our young kids, problem with people, with us in general, is that we want to be too comfortable. It's when we are uncomfortable that we push ourselves to adapt a ability to achieve that level of comfort. But we have to be uncomfortable. That's very important.
And I remember saying that, John, when I did the educational tour with our young people, and I remember the student who went to high school and pull out the pictures and showed his teacher, had that experience, right? And that global experience, and was able to show his teacher, this is actually what it looks like. So he's like basically saying to the teacher, listen, you don't know what you're talking about. Here's the information. Right. So he brought the children. So, maybe I think that's part of it as well. Right. But the question becomes, what do we do as educators? What are we doing as educators to change? Right. To change that that outlook. What are we doing? How do we, as educators, begin the conversation about conquering our fears and moving forward, especially now that we're talking about in the time of COVID? And we know that there will be a significant setback for many of our students. What's your thought? We're losing Joanne again, Dr. Brian.
Can you repeat that?
What is your thought on what do we need to do more? So I hear one of the suggestions is begin earlier, begin the conversations earlier, and you know what? I'm going to put one more in there. Understand that you truly don't know and you need help. Right? Yes. Get rid of the pride. Pride cometh before the fall. You have to really admit, listen, I really don't know this.
That's true.
My mother, that's why I love my mama. I mean, I love my mama for more than one reasons, right? But
it's
one
daily.
Yeah, But my mother accepted that she didn't know a lot of things. So when she came up and did the work that she was doing, she was working for an attorney, a TV executive. You know how we're West Indian. You know how that works. You come in from another country, you take whatever, unless you come with something, you take whatever job. And she was like, you know what? I don't know. But you know what? You're going to know.
Right.
You are going to know. And so I'm going to make sure that you know. Now, she made some boo-boos along the way.
Which is called experience.
Right? But congratulations to my mother. There were 2 children in my house. Well, not my house. Let me not make that statement. 2 children in their house. Right? And my sister was a lawyer, and I'm a school administrator. So she understood. So the first problem is she understood that I didn't know, and I need to ask you. So when I came home with a paper from my guidance counselor, my mama was like, okay, doctor, I don't know if he was there when you were there, Dr. Brackfell. I don't know if he was a guidance counselor, right? My mama said, what did he say? What did Mr. Gentile say? What did Mr. Raziano say?
Mr. Gentile was there.
Yeah, right. What did they say? If they, you know, she acquiesced to the school system, to my teachers or to the lawyers. She's like, get your experience from them because I don't know it. And that's one of the first issues, I think. So adding to what you were saying.
That's the first thing, to really acknowledge that you don't know. And once you know, you want to inquire about it. You know, there's nothing wrong with being uncomfortable, because uncomfortable pushes you to that level to make you want to learn more, seek more, understand more. This is something that it's laziness. Laziness is a disease. It is a disease.
Yep, it is.
You know, my father always said laziness is a disease. You got to get your butt. You got to push yourself. You got to, it's just a whole different dynamics, man, especially with our children. And just as I go back and saying, it's one thing to discuss, but it's another thing for them to feel that they're on the same level as their parents, to have that adult conversation. No, you're still a child, and there's still a conversation that needs to be, that you need to listen when it comes from an adult. So the whole dynamics change. That's why, you know, old man always told me, dad always said, he said, son, in America has too much freedom. Too much freedom in America. You know, and sometimes I never understood. I said, that's what America about. But when it comes to educating your children, disciplining your children, and raising your children, it can no longer be a dialogue in a democracy. It's about a dictatorship.
I 100%, right? I 100% agree with a lot of those statements, right? You know, and reinstill in your child certain values.
Amen.
Right? Certain values. You know, one is to have godly values. You know, you can't forget. Like I never want my child to believe that the buck stops with them. Right? I believe that they need to understand that God is here with you, and He's here to guide you,
And
right? Protect you. That there's a covenant that you need to.
But most of all, provide you that wisdom and discernment so you can deal with all the worldly things that always try to move you away from that spiritual foundation. And on that note,
amen.
Wrap it up. Doc just came and say amen. Let the doctor say what?
Amen.
Yes.
Hey, ladies and gentlemen, I want to thank you for joining us this week on The Village with our guest, Randy Bowen, talking about the mental health of students going back to school and what does that look like through EMDR. And so we want to thank him for joining us right here today in The Village. Remember that The Village, we are dedicated to empowering the community to live a healthy, safe, and financially capable life through education, helping each one of us in realizing our dreams at any age, at any point, starting from today. Success is not just spoken, it is done. What are you doing to be successful? God bless you, each and every one of you. Have a great, great weekend. And remember, this weekend is September 11th, right? September 11th. And our heart, as John said at the beginning of the show, goes out to everyone who had lost or someone who's struggling with 9/11. So just keep that remembrance in mind. School starts on September 13th. That is Monday, that right here in New York City, but somewhere else around the world. Right. So you can always reach out to the Village Talk Show to inquire out. And ladies and gentlemen who joined us on Facebook, who joined us on whatever it means, you got Facebook, YouTube. And if you missed the whole show, go back on YouTube, look up the Village Talk Show, subscribe to the Village Talk Show. We need more people to subscribe to the show.
Subscribe to the
Village Talk Show. God bless and have a great weekend.
God bless.
Safe week.
All right.
Bye.
Bye-bye. Oh, by the way, I forgot.